Hi, this is Chad Ramsey, Vice President of Policy for Ovarian Cancer Research Alliance, and you are here for the cleverly titled 2024 Advocacy Update. If you've been with us over the years, you know that we've had lots of different sessions for policy and advocacy. This time we kept the title pretty generic, and I hope that you won't find the content as generic. But thanks for joining us here on this Friday. It's been a great conference so far, but we're going to bring it home. So here is our agenda for today. We're going to talk about the 2024 state and federal landscape as it pertains to gynecologic cancer legislation, things that affect cancer patients, both at the state level and the federal level. Then I'm going to give a little information on what to expect for the rest of the year, particularly from the United States Congress. I'm going to talk a little bit about a new gynecologic cancer bill that we will be launching next year, and then give you some information on how you can help the advocacy efforts along the way. So I hope that sounds good. If this is not what you're here for, I won't know if you leave, but I hope you do stay. So we're going to start at the state level. And I put this image up because it's the Delaware State Senate. And when I was a young advocate 20 years ago, this was the first place that I offered testimony. And I only mention that because I didn't know what I was doing at the time. And I got a little combative with one of the senators. And I was admonished by the president of the Senate for decorum. But so was the senator. So I guess all things being equal, that was an interesting day. But it was in that room there at the Delaware State Senate. So I thought I'll take a stroll down memory lane with me. But we'll start talking about state legislation. And as you'll see, there's been a lot of exciting things happening. So first, I want to talk about copay accumulators. Now, if you've been with us before, we've talked about this, but what copay accumulator programs are is a way for insurance companies to essentially ensure that patients are paying everything that they need to out of pocket. Unfortunately, while there are some really excellent therapies for gynecologic cancer, they can be very expensive. And for many patients, they require assistance programs. And so pharmaceutical companies or others will have assistance programs based on need that will allow patients to gain some excess funds to cover the cost of their drugs. What some insurance companies have done is count that money differently. So they'll accept that money to go towards payment, but they won't let it go towards your deductible or out-of-pocket maximums. What that means is patients end up having more cost out of pocket throughout the year. So those are problematic. And we've been working as part of a coalition called the All Copays Counts Coalition across the country to enact legislation to try to bar this practice from insurance companies. And as you can see, we've had a good deal of success. There are 21 states so far that have laws to ensure that third-party payments count towards patients' deductible and out-of-pocket maximums. If you look at the chart there, I'm not sure I put the colors together the right way, in a pleasing way, but you can see the green states are where we've got legislation passed. The yellow states all introduced legislation at some time in the past year, and the blue states have had no legislation enacted and haven't introduced anything. So we've got some work to do, but almost half the states have passed laws, and a good chunk of the others have introduced legislation. So more work to come here. Second category of state legislative action I want to talk about is the effort to expand access to comprehensive biomarker testing. And by biomarker testing, I'm talking about genetic testing, particularly important for ovarian cancer patients and their family, or endometrial cancer as well, when you consider any cancer that has potential inherited risk. So ensuring that patients and others have access to comprehensive biomarker testing is critical. we've been working very closely with the American Cancer Society to work to enact legislation across the country. And as you can see, this year we've had some real success. I think 4 or 5 states enacted laws this year. We've worked in quite a few different states, and we're up to 19 states now that have enacted legislation. You can see on this chart, the blue states have enacted bills, and the yellow states had introduced legislation this session. Most of the sessions now are done, and we won't be able to get action done this year for most of these. But if they introduce it this year, there's a good chance that we're going to make progress and pass it next year. So keep that in mind about where we need to go next. Along with access to biomarker testing, I wanted to just mention quickly, we have been looking at a few different states to expand access to protections against discrimination for genetic information. You may have heard of the GINA laws, the Genetic Information Non-Discrimination Act, which does protect patients by ensuring that they aren't discriminated against for employers and others who have access to who might have access to their information about their genetic mutations or genetic risk. So we're working to expand that, though, in some states. In Maryland and New York, both this year, we participated in campaigns to try to enhance those protections. You know, we're seeing people that have access to genetic testing aren't always going through with it. And even through our free genetic testing program at OCRA, people will request the kits and then not go ahead and submit those kits. And so one of the barriers might be concerns that they could be discriminated against. And so that's why these type of bills are really important. We're likely to see campaigns in New York and Maryland next year. We'll participate again. We'll encourage people to offer testimony, and we'll work those legislators to try to get the bills past the post. I think we have a good chance of getting these bills passed next year. And one more classification at the state level of legislation I wanted to talk about was oral chemoparity legislation. As we've talked about in the past, whether a chemotherapy drug is administered orally or intravenously, we think that patients should be charged the same. As it stands currently, many of the oral chemotherapy agents that you receive, or cancer drug agents, cost the patient a lot more out of pocket. And that's really just because of the way the benefits are designed. When you have your drug IV administered at the hospital, it comes under one section of your health insurance plan. When you get it from the pharmacy, it comes out of another. And so what we're seeing is patients that have orally administered therapies are having to pay a lot more out of pocket. We think that that's a problem. We don't want, critical medical decisions to be made because it costs more for the patient. Medical decisions should be what's best for the patient, what's best to treat their cancer, what's best to treat their illness, not how much out-of-pocket expense they're going to have. So that's why these bills are really important. You can see that 43 states and the District of Columbia have enacted legislation on this, and that's great news. Such great news that we really are starting to pivot at the federal level. There's been legislation that's been introduced in Congress to try to enact the same protections at the federal level, which affect a different group of people and their insurance plans. So we'd like to see that enacted, and we'll continue to push that. So that's sort of a snapshot of what's going on at the state level. Now, let me pivot to Congress and the federal level. And you may notice that things are a little bit different. So this Congress has really been historically slow to act. In fact, the 118th Congress might end up being our least productive Congress in history. I just put some facts up there. Over the last 20 years, Congress typically will pass during a session 389 bills. So far, this Congress has only passed 78. That is really bad. And it's been difficult, frankly, to get Congress to enact some critical bills this year that we've worked on. It's really the product of having a really closely divided Congress. The Republicans have a slim margin in the House, and the Democrats have a slim margin in the Senate. And it's an election year. So all those factors combined make it difficult, or has made it difficult for this Congress to move. It's been very frustrating, but there is hope on the horizon. So while this Congress hasn't done much, we have seen some incremental increases in programs that go towards gynecologic cancer education and ovarian cancer surveillance. And so I mentioned them here. The Gynecologic Cancer Education and Awareness Act, otherwise known as Johanna's Law, was funded at $12.5 million this year. The Ovarian Cancer Control Initiative was funded at $15 million. And that represents a $500,000 increase at CDC. We were really excited to get that increase. It's been a difficult fight from an appropriations perspective, and OCRA has really led the charge to at least maintain funding for these programs and increase them if possible. We made an effort along with the Society for Gynecologic Oncology to create a new program called the Endometrial Cancer Research Program. That program would have been housed in the Department of Defense. They have a section of research programs there, medical research programs, called the Congressionally Directed Medical Research Programs, CDMRP for short. Because we've seen such a dramatic rise in endometrial cancer incidence and mortality over the last few years, we think it's time to add an endometrial cancer research program there. So we pushed for that, but ultimately we weren't successful this year. There is an ovarian cancer research program at CDMRP, and that continues to be funded. This year it was funded at $45 million. So that's really important. That is the only federal research program specifically dedicated to ovarian cancer research. There's ovarian cancer research and other gynecologic research done through NIH at the National Cancer Institute, and that's where a lot of the research funds go. But this is the only one that's specifically dedicated to ovarian cancer research, so that's why we think it's really important. So while we haven't had a lot of movement in Congress this year, we could see movement by the end of this year. Sorry, I had to put this cute little lame duck picture in here. The end of the year after the election is called the lame duck session. So in case you're wondering why I put a cute little wounded animal on here, that's why. Congress typically passes a big chunk of bills at the end of the year. After the election and before the new Congress is sworn in January, we'll see a large chunk of bills that get passed. Since this Congress has only passed 78 bills, it's likely that they'll pass just as many at the end of the year, or some package that includes lots of different pieces thrown in. And we think that there's a good chance that some of those will be related to healthcare. It has typically over the years. So we're making a push at the end of the year for a few of our priority pieces of legislation. And we're very likely to reach out to people who may be listening to this webinar right now about specific legislation. So here are some of the priority pieces of legislation that you may see move at the end of the year. The first is the Medicaid Multi-Cancer Early Detection Screening Coverage Act, which is a mouthful. We generally just say MCED, for multi-cancer early detection. What this bill would do is essentially say that once these multi-cancer early detection tests become approved by FDA, and we know that they work, they can be covered by Medicare. And that's a big step, and that's an important step for access for these types of tests. You may have heard of some of them. One of them is Grail's Gallery test. It's currently available for patients. It's not yet FDA approved, but you can gain access to it. And it purports to be able to identify cancer signals in the bloodstream from a number of different cancers, including some gynecologic cancers. And if it turns out to be successful, that is really great news. It could help us identify cancer much earlier when there are more treatment options. So that's an exciting bill. And I'll also note about that bill, I think it may be the bill with the most co-sponsors in the entire Congress. Certainly, it's the healthcare bill that has the most co-sponsors, and it's a bipartisan bill. It has a majority of the House and Senate that are co-sponsors. So that is a bill that's very likely to move. The other bills I have on here include the Clinical Trial Modernization Act. This is really a bill that would allow clinical trial sponsors to pay for some of the costs that patients incur, like travel costs, hotel costs, for participating in the trial. And as many of you know, those costs can really add up. And if you can't afford to pay for them out of pocket, as many people can't, you might not be able to participate in this trial. So that's why we think that this is an important piece of legislation. It would also allow trial sponsors to be able to furnish things like electronic monitoring devices like Apple Watches or things like that to help participants participate in the trial. So that's an important step. Then I have the Johanna's Law Reauthorization Act. Now, we've talked about Johanna's Law a little bit already, but it's important that you understand that Johanna's Law is an act of Congress that requires reauthorization. Most programs that are created like Johanna's Law require periodic reauthorization to ensure that they're successful. Johanna's Law's authorization has lapsed, and so it's critical that we work to reauthorize the legislation. We've worked with Congressman Darrell Issa and Congresswoman Rosa DeLauro on the House side to introduce legislation that would both increase the funding for Johanna's Law and provide some additional language that encourages focusing on biomarker testing, high-risk population, and also health disparities. So that's a critical piece of legislation that we could see move. And finally, I talk about the Reducing Hereditary Cancer Act, which would try to expand coverage for biomarker testing at the federal level. It's very important that we make sure that folks who need germline genetic testing get it. And this legislation would expand coverage for the Medicare population so that we could see more people gain access to these critical tests. So those are 4 bills that we think could possibly move at the end of the year. We really are going to make a push. What's on the horizon? This is a bill that I'm really excited about. The Gynecologic Cancer STAR Act of 2025. This is a piece of legislation that is modeled after the landmark Childhood Cancer STAR Act, which was signed into law in 2018 and reauthorized in 2023. It will address gaps in research, care, and treatment across all gynecologic cancers. Currently, we're in the drafting phase of this bill. We're talking with providers, we're talking with patients, we're talking with other groups to try to identify what the gaps are and how the bill should be formulated. We're really excited, and we're going to build a campaign around this for 2025. Essentially, the bill will address 4 areas: STAR, survivorship, treatment, access, and research. And by survivorship, I'm talking about wellness and prevention, talking about recurrence, ways to try to monitor or prevent recurrence. For treatment, we want to look at gaps in care. We want to look at health disparity issues and issues that affect care delivery. We think that there's lots of areas in there that need improvement. With respect to access, we want to look at access to gynecologic oncologists. We know that in some states, there may only be one gynecologic oncologist in the entire state. People may have to travel 500 miles to reach that sort of care. That's a problem. Genetic counseling services are often difficult to schedule. They're overworked. There are not enough of them. And that can be a barrier to care or getting the right care. And we also want to look at research. I already mentioned earlier the disparity in research for endometrial cancer. But in general, gynecologic cancer research is not funded at the level it ought to be. That's a problem. So we want to encourage more funding for gynecologic cancer research. But we also want to talk about improving collaboration between the agencies. We hear that there's occasionally siloing that takes place in NCI and other agencies that conduct research, and we think there's probably better ways to work together to jump off each other's research and to gain access to that. That will help move the ball forward for research in a much quicker way. So we're excited about that. So that's the Gynecologic Cancer STAR Act. More details will be coming out as we continue to draft and get it finalized and ready for introduction. So 2025 will be a critical year. As you may be aware, we will have a new president and a new Congress. That represents new challenges or opportunities for us as an advocacy organization. Depending on how the election goes, it may determine some way or another that we have to proceed with respect to strategy. But no matter what, we're going to be out there pushing for improvements for gynecologic cancer patients across the spectrum. The thing is, I can do that, and the rest of the OCRA staff can do that, but we're not the most effective advocates. The most effective advocates are you, the people tuning in to this today. So I encourage all of you, frankly, to consider joining our Advocate Leaders program. This is a nice little postcard that we have, and we have a session where we talk about what you can do and how you can be involved in advocacy or other elements of the organization. So hopefully you were able to attend that. But if not, that's the postcard. You can learn more about the advocacy program at ocra.org/advocacy. I encourage you to do that. But really, I want you to become an advocate leader. We give a good amount of training to the advocate leaders early on. So if you're saying, I've never done this before, I care about this issue, but I'm not comfortable being an advocate, don't worry. Come in. We've done this every year where we go through a training program. We provide you with lots of materials, provide you with mentors, and it gives you an opportunity to have a real impact. You'll be able to attend in-person or virtual OCRA advocate leaders advocacy days to advocate on Capitol Hill. You'll team up with your fellow advocates and hopefully respond to our calls for action. There's a real sense of camaraderie that forms amongst the advocate leaders. And, this program is really the envy of a lot of other cancer organizations because our advocate leaders are so strong and they represent, an important community. I can go in to a meeting with a legislator or legislative staff and tell them the facts and figures and tell them what we need, and they'll listen to me. But when you come in and you tell your story and explain why it's important to you and what you've had to struggle with, it means so much more. And that's why we rely so heavily on our advocates and, really, want to spend a lot of time making sure that this program is successful. So look at this map. we have 39 states represented. This map is the bane of my existence. I want it to be entirely green. It should be entirely green. We have more than 100 members in the program right now, but we want more, and we want every state to be green. If you're from New Hampshire or Vermont or Rhode Island or Arkansas or Kansas or Nebraska or Wyoming, New Mexico, Hawaii or Oregon, we need you. We need you from all the other green states as well. But if you know anybody from any of those states that are unrepresented, definitely we need them. We want people from every state. If your state is already green, it doesn't matter. We need you. We need more of you. Ideally, we would have somebody in every congressional district in the country. That's 435 advocates. We could add Puerto Rico. We could add others. So, I don't have Puerto Rico on here, but I probably should. If you're from Puerto Rico and you're watching this, definitely apply. We want you. And this program is open to all survivors, family members, supporters of all gynecologic cancers. We can really represent the community if we have representatives of the community. And, we will do everything we can to teach you how to be an advocate, to give you information, to give you timely updates and alerts about legislation. But we also learn from you, and you learn things on the ground. You learn who to talk to. When you create these relationships, you help us as an organization get better, and we benefit by having as large a group as possible. So please consider becoming an advocate leader. You can apply right now to join the advocate leader. Our application portal is open. Go to our website and you can find the application portal there. The first one is for generally advocate leaders to find out more, and that is where the application will be or is. OCRA.org/advocacy/how-you-can-help/advocate-leaders. So I will put this in the chat so you can have access to that link. If you're not ready to be an advocate leader, that's okay. But you can take action on any of our current action alerts, and you can do that at the other link here. I'll also put that in, so I'm not going to read it out, but that's OCRA.org advocacy, how you can help take action now. That will have all of our action alerts up on that page. That's very important. So I encourage you to consider, if you're at all interested, being involved, getting your friends involved, your Facebook friends. If anybody you've talked to seems like they might be a good fit for this, send them our way. And with that, unfortunately, we're done. I really appreciate you taking the time to listen today, to hear some of our successes and some of our challenges. You can reach out to me at any time, Chad Ramsey. My email address is cramsey@okrahope.org. Or you can talk to or message Julia Thayer, who's our Associate Director of Advocacy at OCRA. And she's JTHAYER, jthayer@okrahope.org. Thank you so much for taking the time. Hopefully the things we talked about today make sense, but if not, send me an email when we get you sorted. And otherwise, once again, in case I haven't said it, please consider joining the Advocate Leaders Program. Okay, thank you so much. Hope you enjoy the rest of the conference, and we'll speak again soon.